one of our priority items very recently has been to strengthen our communication with the field. We have been working quickly to balance having really efficient, fast communication to all of you and making sure that it's easy to understand and easy to access. So there's one new website that I would like to encourage you to take a look at, in addition to the resources that I'm sure you're already familiar with. The Department of Education and the LARA, the licensing team, have been working with partners across state agency to put all of the information that state government is trying to put together for you in one place. So that rather than trying to have to make sense of information from several different websites and several different agencies, we're working to get those frequently asked questions all in one place. So this is a screenshot of our website of the topics that we cover at the michigan.gov/coronavirus website. That's the place that I want you to bookmark. If you go to that site, there's a section called resources, and there's a page that's dedicated to childcare. So you can see things about updates about closure, information about health and safety, licensing, the child development and care program, and on. You can see all of the categories here. When we get questions from you, from people directly in the field, or from partners like the folks convening this call, we're working to put that information on the site as quickly as possible. We also know that many of you are familiar with the sites that MDE and LARA already maintain. We are cross-posting all of this content so that regardless of where you end up, you're able to get the information that you need. I know when we asked for questions before we convened the call, Erica asked, what is the state doing to make sure that communication is clear? This is one of our biggest steps in that direction so far. I would also encourage you, I know our systems are often fragmented and our providers work pretty independently. Please elevate your questions to folks like Erica who can help us aggregate that feedback and respond to it. I know Lisa and Mark will talk about outreach strategies with their offices specifically, but elevating those questions that you have allow us to be able to be responsive to you and the whole field. The next area we've really been looking at is barrier removal. What are the challenges that are existing in the field today that are potentially unique to the COVID-19 emergency, and can we do anything to help? Mark, this is really starting with your area of expertise. Would you mind unmuting and giving us an update on some of the licensing flexibility and some other recommendations that have come from your team?
Okay.
Yeah, this is Mark Jansen, licensing. And the first part is the licensing flexibility. And if any of you are able to get to our website, there is a document there for licensed facilities. And about 3.5 weeks ago, the executive office asked us to go ahead and figure out some licensing rules that we could really let up on, I guess I would call it. And so in a document on our website, you will see where we have reduced a few of the rules that you have to follow if you are a licensed facility. We also were asked basically, I'm going to go down to the fourth point, figure out ways to help businesses who would like to set up a temporary childcare. So the executive office asked us to work with them and others, and that's where the disaster relief childcare centers were set up. And if you go to, again, to our website, you'll see a 2-page application for, let's say we have a number of hospitals who have set these up, and they are childcare providers. They're usually run in partnership, let's say with a hospital, long-term care, places like that, or there's some private businesses as well. And they only have to fill out this 2-page application. And then once we have done an on-site and looked at the basics of the the building. We, within about 48 hours, have been giving them their, what I would call a provisional temporary license. And then every week we're they're going in to do a wellness check, or we're calling in to do a wellness check with that provider. And so, so far we have 9 sites that have done this. They are also listed as locations on this website. So you can literally see who's out there and has one of these, what we call a DRCC, because we love acronyms in native Michigan. And so we have done the flexibility, the health and safety recommendations, the second point. We have primarily worked with Department of Human Services. They have that COVID-19 site. The executive office has been the lead with DHHS. We have tied almost all of our health and safety recommendations using that central point for any childcare providers or parents that would come to our site. We have also encouraged strongly that providers would work with their local health departments. We were finding that the local health departments were adding really higher levels of expectation depending on which county you were in. And so we quickly said the local health department needed to be a contact for you out in the field, as well as our staff. The third point, I'm going to, I think, give that to Lisa. So I'll go to the 5th point and then let Lisa get prepared. The regular communication with us. Our team has been meeting regularly. All of my managers, who also meet with all of their consultants digitally. We have some of our staff doing special investigations on site, but we're trying really, really hard to do most of our work digitally, and trying to call providers, email them, make contact that way. And I can talk about some of the things that we're doing in this time period to help providers in the long run, but I think I'll say that for a little later. And so I'm thinking the Child Care and Development Fund policy changes. I'm thinking that would be Lisa, if she's there.
Erica, I think if you can go to the next slide, we have some of those listed there as well. Thanks. So we also have been working to identify where, under the federal rules and regulations for the child care funding, we have some flexibility and some opportunity to make changes to support children, families, and providers as we work through this unprecedented scenario that we're all facing. We've worked to make some changes to subsidy billing, specifically allowing providers, whether they are closed or open, to bill using regular child care subsidy hours versus using their absence hours, because we do have a limit on the number of absence hours connected with subsidy. So that provision is currently in place through the latest executive order of April 30th. And again, that is for programs who are either closed or open and being able to bill based on the enrollment of those children, not necessarily their attendance. We also work to expand the number of hours that school-age children are authorized for. Again, with the closure of schools and the stay home, stay safe, we knew that there were school-age children who may also need additional hours available for care to support their needs. So those hours have been expanded, and those expansion of hours stay in place until that that child or that family's eligibility comes up for review after their 12-month eligibility period. We also extended redeterminations for families. We didn't want to have families worrying about turning in information about their case during the stay-home order. We wanted to continue to make sure that childcare subsidy was available to those families without interruption. We've also been working to address questions around training that have come up, trying to move to virtual trainings to the extent possible so that providers still have the support that they are used to receiving from their Great Start to Quality resource centers and the staff that they work with in those locations to meet their needs. We've extended provisions around Great Start to Quality ratings so that ratings aren't expiring during this period of time, and that providers have additional time to submit the information necessary to either increase their rating or maintain their rating. I think those are some of the bigger pieces that we've done around childcare subsidy specifically. Also at the website that Michelle mentioned, where we've been consolidating all of our information. We did provide some information on the payroll protection program and other opportunities that might be available for small business owners. Those opportunities are available through banking institutions. So we tried to provide the basic information that providers might need to reach out to a local banking institution to help apply for those funds or find out how they can be eligible for those funds. Michelle, did you want to talk about unemployment insurance?
Yes, thanks, Lisa. And I am taking a look at the chat and noting some of your questions, and I know we'll continue to follow up with them as we go through the conversation today. So unemployment insurance is also available to many of our childcare providers that are closed. I know effective Monday, the Unemployment Insurance Agency opened up applications for people who are sole proprietors so that they are now eligible for unemployment assistance. I know there are lots of questions that are pretty specific to the childcare field and the impact or the intersection between childcare and unemployment. We're working right now with the Unemployment Agency to get good guidance for all of you on the impact of policies and your eligibility for unemployment. So watch that coronavirus website for more updates in the coming days. In general, however, I know the Unemployment Agency has done a lot to make the process more user-friendly. So be sure to visit michigan.gov/UIA. That's michigan.gov/UIA. They have a lot of tutorials for employees on how to complete the process, what the expectation is of you, and what kind of funding you can expect in what timeline. We are happy to be helpful to the extent possible, but unfortunately are not experts in the details of unemployment. But like I said, for questions that are specific to childcare, we are working in the background to get some clearer FAQs up there for you in the next few days.
Thanks, Michelle. So a lot of the questions that Mark, Michelle, I, and others have received and have been working on really focus around financial support for providers. As we've mentioned, we know this is a really challenging time for providers, whether they're open and serving essential workforce children or whether they've closed and are thinking about what they will do to reopen when some of the provisions are relaxed. At the federal level, there was a bill that was moved through by Congress and signed by the president. It's called the CARES Act. Of course, as Michelle said earlier, we could have all kinds of acronyms and initials, so why wouldn't we have another one? This funding really was put together to address questions that all of the states were getting from childcare providers and administrators and others who work in the field to support those providers. It's put in place to make sure that we have opportunities to help support providers who are currently caring for essential workers' children, being able to support them, as well as thinking about what is our supply of the early childhood workforce going forward. So has flexibility around those two big, broad provisions, which match the work that Michelle outlined at the beginning that we have been really focused on. So as we continue to work through the pieces of that CARES Act and those funding provisions, funding will be available to support both of those financial aspects. We're working to make it as flexible as possible, get it to you as quickly as possible so that you can utilize that funding to help meet the needs that you might have, whether it's around current operating costs, supplies or materials that you might need, or if you're planning and the supports that you'll need to reopen. And we know that you will have many creative uses and ideas for this funding support once it's available. And we want to leave those decisions to you so that you can best support your needs and your program. I know one of the questions that Erica sent us was also around whether or not unspent food program dollars could be used to support program costs. So we reached out to our friends in the food program, and unfortunately, those funds can only be used to support food costs. So they are not able to be used or moved around for other purposes. But watch for more on our CARES Act funding and the supports that will be available through that mechanism soon.
Yeah. Lisa, I'm seeing a few questions coming in on the chat. Can I follow up and ask you a few of them?
Absolutely.
So one of the questions said that families are continuing to apply for the subsidy, but that approvals are moving slower than normal. Do you have an update on that?
So as you can all probably imagine, the number of assistance applications that are going in through the Department of Health and Human Services and My Bridges are at a higher level, similar to the volume that Michelle mentioned with unemployment insurance. I know that they are working very hard that as soon as that application information is complete, to move those applications through. But oftentimes what happens is when those applications are submitted, not all of the required information is included, which then requires more back and forth between the local office, DHHS staff, and the individual who applied. Normally, those applications can take up to 30 days once they're complete. So I will do some more double checking with DHHS to see what might be incomplete in the current applications that are coming in so we can get better information out to individuals about what to make sure is included.
Lisa, a couple more questions about the billing changes you mentioned about the childcare subsidy. One of the questions is about school-age children. It says, it's asking what hours providers should bill for school-age hours, for school-age children. Should they bill for before and after care or for full day care as if they were on break?
You should bill for when that child is enrolled in your program. So if that child is currently coming or was previously coming for before and after school, that's what you should be billing for. If that child has transitioned to full day care because their parent is an essential worker, then you should be billing for full day care.
I'm also seeing a number of questions about unemployment insurance, a few noting how frustrating it's been to go through the application process. I know the Unemployment Insurance Agency has been doing as much as they can to make the system work effectively for all of you, and we know that it is slower than any of us would like a lot of days. So a few tips. First, the UIA has published a schedule for you to file benefits by last name. We ask that you adhere to that schedule. It really helps with call volume and the number of users on the website so that you get a more responsive experience. The other tip is to apply after hours. So between 8 p.m. and 8 a.m., there are just fewer people on the system, and the application seems to go smoother at that time of day. The other thing I will note is I appreciate how frustrating it must be to ask for your patience, but please know that unemployment claims are backdated, which means that whether you are approved today, tomorrow, or next week, that will not have an impact on how much funding you are able to receive. We are also committed to making sure as a state that every single person in Michigan who is eligible for unemployment has the support they need to access the system. So even though it is slower than we would like, please stick with us. We are really committed to working with you to get you the answers that you need, specifically around things like the impact of your subsidy payments on unemployment. That's a question that we've raised with our partners at the Unemployment Insurance Agency so that we can give really accurate information to all of you.
So,
Another
Lisa,
question.
one of the questions, oh, sorry, I was just going to say, one of the questions that came up is how are providers, oh gosh, so if a provider is licensed as the person who is providing DHS subsidy care for a child, and then the child goes somewhere else, how will that impact that child?
So that's also a question that we're working really hard in terms of federal guidance and what's allowable. We believe that we'll be able to address that question and issue and ensure both providers are paid through the CARES Act funding and the model that will be used to get those funds to childcare providers. We're aware of the question and working to try and break down that barrier and ensure both providers can receive payment.
I saw a few more questions about unemployment insurance. One was from the perspective of an employer, and I'll note that in the same way that UIA has great information for employees, they also have really excellent FAQs for employers. And one of the questions was, will your rate of unemployment tax change if your employees apply for unemployment? And the answer is no. That's a question that is addressed in more detail on the UIA site as well. I have gotten a couple of notes privately about the unemployment application system, and I truly want to thank you for your patience with this and know that the system will work. I know follow the tips that they're offering on the UIA site and keep trying.
And someone said, just want to clarify that we do bill DHS even if we are not charging tuition during closure.
Correct. You still submit your billing to MDE and MDE will issue those payments.
So another question came up related to, perhaps this is a Mark question, what type of additional guidance and or changes to regulations might programs expect to receive from LARA when reopening when we're able? For example, will changes be made as it is related to requiring smaller group sizes, additional cleaning or sanitizing, temping throughout the day, etc.? So anything you can have to offer on that.
Thanks. I would suggest that we're going to be working with Governor's office on the transition from when the state of emergency is lifted, and we'll have these kind of discussions. So I will be looking for ideas. My sense will be We'll do a transition time between the state of emergency being lifted to when we begin the kind of what I'll call the regular licensing process. At this point, I have my staff reviewing anybody who's due for a renewal or an interim during this period. We're trying to figure out the best way to be able to kind of get those going as soon as the state of emergency is lifted. We've been trying to do as much digitally as possible, and then maybe do shorter on sites once the emergency is lifted. But we will continue to kind of review how we help you get open if you want to be open, because I think it's going to happen in a bit of a hurry, but probably not everybody at once, because maybe all the workers aren't going to come back to work the day that the emergency is lifted. So I think the transition time will be very, very important. So we will work really with a lot of different folks to try to figure out the best way to make sure that we respect what you're trying to accomplish. The other thing I would put out there is we've dealt a lot with the local health department. So I would pay attention to what local health departments are telling you. It would be afraid to ask them to say, hey, if I'm going to reopen in the next 30 days, what would they suggest? What would they recommend? And then the COVID-19 site, we'll be really referring to that, and CDC as well, because I'm sure there will be discussions about the best way really to proceed once this happens. Michelle and Lisa and I have had now the last few days regular conversations about how are we going to transition, how are we going to get everybody open, how are we going to make this work well for everybody involved. So I don't have all the answers, but we will be working on them as we look at the emergency being lifted, we hope, well, I'm not going to guess, soon, I hope.
Yeah, I think that's absolutely spot on, Mark. And I'm seeing a few questions in the chat about supplies, particularly around some of the materials that are really challenging to get right now, cleaning supplies, PPE, etc. And I know for those of you who are open right now, if there are supplies like that you are not able to get, your local emergency operations center is an asset to you in that we put their contact information in our FAQ. I will flag that's only for individuals who are open right now and serving children. We acknowledge that longer term we'll need a strategy to help all of you connect with the health and safety materials you need to be open and serving children. In every industry across Michigan right now, getting those supplies is difficult, and we've been working with the emergency operations folks at a state level to have a strategy that helps you get the materials that you need to be safe for the children you serve, but also for the staff members who work in your facilities.
So Lisa, here's another question for you. In reference to both two providers billing for a child that is attending another center while their normal center is closed, should both centers be billing now or wait for further information?
So if they're both currently in our system as subsidy providers for that child, the billing system will still follow its normal process and parameters and limit the amount of billing, which will be a flag for us, and those providers can follow up with staff in the office. But if one is not a subsidy provider currently and the other is, the non-subsidy provider doesn't currently have a way to bill. So it really depends on the unique situation. I would suggest calling our 866 line, our toll-free number, 866-990-3227, and having those providers talk directly with staff who can answer.
Yeah, and Erica, we have that phone number on the last slide of our PowerPoint if you want to click to that. That way people have access to the website and to the phone number that Lisa just mentioned.
Michelle, here's a question for you. what about providers that are still open and have a couple of kids? I'm making no income after expenses. Can I apply for unemployment since I've gone from 12 kids to 2 kids and has now had a huge economic impact due to COVID?
Yes, so thank you for raising that. That's one of the questions that we're confirming how childcare providers should deal with that. So in general, the unemployment system is designed to help in that situation, and we just need to get better guidance to you on how you document your circumstance and what the unemployment situation would look like. So that's one of the questions we're looking at. The other one, which I've seen come up a couple of times, is what is the impact between you accepting subsidy payments during this time and whether you're eligible for unemployment, and then whether or not it matters if you are receiving those payments in your own name or in your business's name. So I want you to know that we have captured those, and unfortunately I don't have an answer for you today, but we will make a commitment to getting those and getting them up on the website. And once they're there, Erica, maybe you can help us push that update out to the folks who are on the line today.
Sure. There's also a few questions around Great Start Readiness Program. One is Great Start Readiness Program has not been directly addressed in executive order in the same manner that K-12 has been, but many of the classrooms are linked to those programs. In many districts, we're flying blind in classrooms that have already been fighting for inclusion and respect within those systems. Those classrooms are nearing the end of their school year. When can we expect guidance from MDE or the governor's office on the programmatic requirements to maintain the funding?
Yeah, I can take that one too. So we are incredibly grateful for everything that all of our childcare providers and our early educators and our preschool educators have been doing to support children and families during this time. We know that there needs to be more clarification about all of our birth to 5 programming that is supported or operated. The governor's office has been working very closely with the Department of Education to make sure that we get guidance out to the field very soon. Unfortunately, that will have to be another item that we follow up with you about. But please know that the value of those programs is certainly not lost on us. We believe that's a really critical part of this infrastructure, and we want to make sure that we get you good information as quickly as we can.
So on here, there's another question about the clarity of the essential worker definition. So if we have a teacher as a mom and a bank worker that is working from home, we're supposed to take those children from the way the wording currently is in executive order. So just one essential worker allows us to care for those children, correct? So that's probably a Mark question. For Michelle.
yeah, Michelle probably just quickly, but yes, we have a Q&A. If you could look up our Q&As out on our website, yes, the answer is they just need one of those workers to be essential.
That's correct. And the obligation for childcare providers is that you ask the families that you serve whether one of them is an essential worker, and if that family member confirms that one of them is an essential worker, you are not obligated to verify that as the child care provider. That's an obligation on the individual seeking care. On the coronavirus site, so that was michigan.gov/coronavirus, there's the most comprehensive discussion of what an essential worker, who counts as an essential worker under the definition here. Sometimes you'll see the site use the term critical infrastructure worker. For the purposes here, think of them as synonyms. And if a family that you're serving fits into either of those categories, then they would be eligible to have care right now. I am looking through the questions. Do you have more, Erica?
I've gotten some privately as well. So someone had sent me, we have a site that is closed right now, but had a planned relocation at the end of May. Now that we are considering not reopening for a week or two, only to close and open in their new location, what do we need to consider and plan for with licensing?
I would say that they should continue to work with consultants. We are opening up new facilities, so they would want to be looking at the licensing, the typical licensing process. There's probably some details I'd want to hear more about, but basically I would say they should be connecting with their consultant. If they have trouble with that or whatever, just email me my email in this slide presentation.
I know that we have already sent a note to Erica asking her to share with us all of the questions that are coming in the chat. I know we're going through them, as many of them as we can, and so we'll go through all of them and either respond to them in our FAQ or put them on our list. I've seen some things about how difficult it is now to get supplies, but how difficult it will be as more providers reopen. So when we start and continue working on a strategy to get all of us back to work, that's an item that is a very high priority for us. And we'll make sure that we go through all of these and address them to the best of our ability.
So also a question on, this might be for you, Michelle, for the new pandemic EBTs that were awarded, there was some question about Head Start and GSRP children not being included in that, as many of them also qualify for free and reduced lunches.
I can take that.
Hold on, you're muted. Sorry.
Erica, this is Lisa. I can take that one. We reached out again to our food program partners to ask that question to make sure we got you the right answer. They are going to be eligible for those cards. It's something that they were working on yesterday and today. So hopefully that access happens very soon, but they will be eligible.
Great. One concern that came up on, let's see, going over some of the pre-submitted questions, there's been more added to them. There was a comment about how distressing it was for early childhood professionals who have been working to improve quality in their programs to have the governor allow anyone to take care of children, suspending many licensing requirements for unprofessionals, at the same time requesting that licensed providers could not violate any licensing rules. So there's concerns within the community that illegal unlicensed childcare will grow and continue after this has passed. And so that, I think it was an expression of concern there. So maybe just thinking about that, or perhaps responding to that.
Yeah, I really appreciate and understand that concern. I know Mark noted before that we've only had 9 disaster relief childcare centers open in Michigan. That's because providers like you have really responded to the call to stay open at a really challenging time. We know that our system is fragmented and quite decentralized, and the governor needed to look for a way to make sure that we were protected if there was a high demand for care. What we've been seeing is that private childcare in virtually every community across the state has been able to manage the demand from our essential workforce, and that is a big testament to everyone on the phone and many, many others who have been willing to take on that challenge. So our gratitude to you and all of the effort that you've done to make sure that children in this state are served well at this time. Thank you.
So a question in the chat related to unemployment. So after the stay-home order is lifted, I will need my laid-off staff to come back, but I'm worried that they will be making more money on unemployment. What recourse do I have if they refuse to return to work?
Yeah, I understand that question. We will clarify in the FAQ for employers that question. Our understanding is that if you are called back to work, you are expected to go back to work. But that's an item that we will clarify in our FAQ as well.
So can providers or programs care for families that say they are essential workers but are working from home?
Yes.
So then there's a question about a licensing. If I'm assuming our license will be extended as our license is up in June and our normal school year ends in May. Our renewal paperwork was turned in early March. Will we look forward to a visit in the fall?
That would be, oops.
We can hear you, Mark. Now we can't.
No, we can't. Oh, he muted himself now.
Okay, try that again. Yes, we're going to transition as well when it's lifted to catch up with the renewals, catch up with the interim. So until that is accomplished, you'll be able to assume that you're going to keep your license without an issue.
I know.
Question, oh, sorry.
Nope, go ahead, Erica.
There's a question that came in privately. Did I hear correctly that if we charge tuition for preschool, we can now charge MDE? If so, how do you do that? So maybe that's more related to subsidy.
I'm trying to understand that question. So if I don't answer it to meet your needs, please clarify. You can bill for childcare subsidy if you're caring for a current subsidy eligible child and they have identified you as their provider. And how you operate your program while you're caring for that child, the schedule of your day, the activities that you do, those are not outlined by childcare subsidy unless you're participating in Great Start to Quality and trying to meet those higher levels of quality to receive a higher subsidy payment. But if you are strictly a quote unquote preschool program and children who were attending your program prior to the pandemic, and they were not receiving childcare subsidy, there is not a mechanism for you to currently bill childcare subsidy for those children. Hopefully that answered your question. If not, let me know.
So another one that's came in on the list after I sent them to you. Are providers expecting DHS to continue to allow full billing for children not in attendance until the stay-at-home order lifts, or do you anticipate that it will continue past this? They mentioned it's been a week-by-week course, and to better plan for loans and other financial system assistance, it would be nice to know.
So currently the frequently asked questions allows that through April 30th, which matches the most current executive order. Again, we're trying to coordinate that package of supports that were put in place with what will happen with the CARES Act funding. So as we continue to coordinate the rollout of that and any new executive orders that come out, we will continue to release that guidance with new dates and around those provisions.
So there's a question so related to the no price gouging or executive order that the governor put out. We now have parents that are upset with hold policies and state that they feel they're being price gorged to hold their spots. Could you clarify if this is or is not price gouging? In my handbook, it stated that parents who want their child to return to their original schedule after a layoff, maternity leave, or other event, they must pay a hold to return. So yeah, I'll stop with that for right now.
Mark, do you want to speak to that or me?
I'll speak to it. We put that question in frequently asked questions as well. This is really a contract issue between the provider and the parent. So we have just said to anybody who asks that if they have any questions that they should talk to their provider. And if they have any other issues, then we did have on our Q&A that they could talk to the Attorney General. We have changed that now. It's just they have the right to talk to an attorney if they want. And I don't even think we added that to the list either. So it is really an issue between the provider and the parent, and it is a contract issue. So for us in licensing, we have no control over that. And I can tell you, I don't want any control over that. So.
Thank you. There was just another question to clarify. Are providers able to bill DHHS for subsidy children while we are closed if we are not charging the families?
Yes, that is allowable under the current FAQ and provisions that have been put in place.
And someone else was just confirming that if parents are working from home and they're considered essential workers, they are allowed to care based on what you responded before, right, Michelle?
Yeah, that's right. I know Executive Order 2020-42, which is the latest update to the Stay Home, Stay Safe order. We got some questions clarifying that. If you look at the FAQ that the governor has posted, the executive office clarifies that point, that you can continue to serve for essential workers that are working from home.
Okay. I am not seeing any more that they have not addressed in the chat, and granted, there's been several, but there's some, let me see here. And I don't see any more. So a question just came in. Can you share the best contact to help families that were removed from receiving DHS subsidy?
So again, if you have a specific case number for that family because you've been working with that family, I would encourage you to call the 866 toll-free phone line. Our staff can look into the eligibility system and determine why that family's subsidy may have ended. Oftentimes can help give tips and suggestions for what to do to get that case reinstated. So I would start there to see if we can look up that information and help identify the steps that are needed to fix that to allow for that billing.
So another question came in. What if a family chooses to delay the start of their child because of COVID was just beginning and who was approved for subsidy? Would those children be able to be billed based on the planned schedule of attendance?
So again, the provider can bill for children who were enrolled based on their attendance schedule. So if a child hadn't started, they wouldn't have that enrollment attendance schedule in place yet.
Okay. I think, are you seeing any more, Michelle? That
I'm scanning right now as well, and I know a few of you who have messaged me privately with more complicated questions. I did provide my email address, and it is on the slide, in the slide deck. We are all available to support you. I know we'll follow up with Erica after this to set up a time to follow up with all of you so that we can work through the next set of questions. We know the situation and continues to change, and the needs that you have and the updates that we have are moving fast, and we're really working to make sure you have good information, and the association is a really great place to start. The michigan.gov/coronavirus website is another really great place to start. And we appreciate, like I said, everything that you're doing. And please know that you have a lot of people that have your back, even if the work is slower than any of us would really like it to be.
So there's a couple people that have questions. Is it okay to take some? We've got people with hands up.
Please.
Okay, Summer, how about you? I'm gonna unmute you first.
Hi, thank you. So I am a family provider and I have no employees. And I've applied for the economic deferment loan or whatever that's called. And originally it was supposed to be $10,000 advancement. I contacted the local SBA organization, and now that's been changed to, I just got the email, it's been changed to $1,000 per employee up to 10,000. And it's just me. So I haven't gotten anything yet. I don't know if I'll get 1,000 or nothing. And then the PPP loan, it didn't open up. It was opened a week later than the organization's application. And by the time it opened for us on whatever day that was, Friday or something, my credit union had already stopped accepting applications because it had gotten too many. They couldn't suggest another bank. the bank that we have our mortgage through would only take it if you had a business loan, a business account with them. And I can't find another bank that will do it unless you have already have a business account with them or an existing account. My credit union couldn't offer suggestions of anyone else to work through. I've applied for unemployment. That I know is going to take a little bit. I'm being patient. I've done all the updating. So I'm just wondering if you have any other suggestions, because as a family provider, I don't have a bigger business and I don't have employees. So right now I'm looking at $1,000 and that's it, until unemployment comes through.
I can get us started, and then hopefully my team can jump in too. So you are definitely not alone in that challenge. We've seen feedback from people across Michigan and frankly across the country who have had a similar challenge to applying for the PPP loans. I did reach out to a partner we've worked with historically in banking to say, what more can we do here? We're meeting tomorrow to see if there is anything else that we can do while not controlling the program itself, to be able to position our providers to have a better chance at receiving those loans. So we are continuing to fight for you and make sure that you have the support you need. The other place that we're really working is, Lisa had mentioned earlier, this Federal CARES Act money. Is we are working to stand up some grant support for providers like you to be able to make sure that you can stay financially solvent during this crisis. And we want you and need you to open back up when the time comes for all of us to do that. And so we're working in the next few weeks to be able to stand up those grant programs to be able to support you.
Okay. Thank you.
Okay, and Ann Brown, I'll unmute you. You can ask your question. Ann, are you there? Okay, not hearing that. It looks like a few more have filtered into the chat. Let me take a look at that. Someone asked to put the page back up with the link, so that's up now. You should be seeing that on your screen right now. There's also been a question about the slides and the recording. And yes, we got a little bit late start on the recording, and as long as it's okay with our presenters, we can share the slide along with the recording after the fact. There's lots of questions about the different loans and whatnot as well that have come in related to that.
Yeah, another place to look for feedback about loans is the Small Business Association of Michigan. They are working to put resources online for all small businesses. It's not childcare specific, but they have really comprehensive tools and have encouraged us to send you to their site. So that's the Small Business Association of Michigan, sometimes called SBAM. And their website is almost exclusively dedicated to PPP and the SBA loans and many of the other supports available to small businesses. That could be another resource if you're looking for more technical assistance.
So there was a question on how people can get updates, and I know you posted the communication link on the website, but how they can know which things have been updated. Is there like an indicator on there that shows that something's been updated, or would they just need to kind of go through and look and see? And then another question was kind of tied to that was, if programs are closed right now, the best way to get information, I think, based on what you said, was to go to visit that website with the childcare links related to coronavirus, michigan.gov/coronavirus and childcare.
That's right. We've been working to flag the information on the site that's new. We just officially stood up that iteration of it a few days ago. So you'll see there aren't anything flagged as new, but we've been working to update that so that you can see the content that is new. I also know partners like AEYC and the Early Childhood Investment Corporation and many others have been working to put on social media when there are updates so that we can share with you on a more regular basis. And like I said, Erica, we'd be delighted to be invited back and continue the conversation and continue to give updates about where we are and what's coming next. We can work with you offline to set that up.
That's great. There were a couple slides here that this one right here, I didn't know if you wanted to, if there was something specific you were looking for related to this. I know you talked about getting input from folks. Is that what you were looking for here?
Sure. I feel like we've been able to hear a lot from you on the questions that you've been answering through the chat, which is why I had encouraged you to skip over it, but I didn't mean to miss the opportunity to hear from you. So I certainly, if there's additional things that are happening in your local communities that you think are helpful or important for us to know, please put them in our inboxes, enter it in the chat now, so that we can understand what you need and how we can be most supportive to you.
Okay, I am not seeing anything else come through my message box here. I don't know if any of you have any that have come through that we haven't addressed.
Erica, this is Mark Jansen. Can I say two quick things?
Of course, of course.
Okay. One is for providers. If you're a center, the new rule book should be being mailed. We are told April 21st, but we are behind unemployment mailings, so we would rather have unemployment sent out, but just know the center providers should be getting their new printed rule books in the next, I hope, week or so. And the other thing that I want to bring up was the executive orders are beginning to expire on some of the ones that we're working on in childcare especially. So kind of watch for childcare. We will send something out that says, hey, here's some new information that may impact childcare providers because of the new executive order or the extension of the executive order. So just for everybody out there, just know we're kind of in that period where a number of them are either expired a day or two ago or are going to expire in a day or two. So I'm not sure what's going to happen as far as the new executive orders, but that might be something worth mentioning for folks.
Thank you, Mark. Summer, you have your hand raised again. I will unmute you.
Yeah, I just wanted to talk to this, what is happening in your community. And there was a thing on the news about parents complaining about paying for childcare. And it was very, in my opinion, very one-sided. And so I just, to get people thinking before you send emails in, that there's a lot of things that providers are doing even while we don't have kids, those of us that don't have kids. And I think that it would be really beneficial for families to see that providers are still working. We're taking webinars, I send videos out on my Facebook page every day, reading 2 stories to my childcare kids every day, so they're still staying connected. That some of us are working on, assessments that we would be doing at this time of year anyways. And, that there's a lot of things that are happening, working through unemployment, working through small business loan applications. So that there's a lot that providers are doing, and that the fact that this news article went out saying that, we're just forcing parents to pay, when there are a lot of parents who are working from home and getting their income, and that they could still be meeting their bills if they're still being employed and still getting their income. And there wasn't anything mentioned about this, the fact that we can't actually legally care for kids unless they're an essential worker's child. And so I don't know, I think thinking about that and knowing that that's happening in our community, that there isn't that other side of it, that providers, even though we don't have kids, we're still doing things, we're still working, we're still doing things, and that this wasn't necessarily always a choice for us. That yes, we're essential, but there are other factors that came into why we were closed and what we need. And anyways, I just wanted to put that out into the space.
I appreciate that. Thank you so much for sharing that.
Anyone else have any thoughts to share or want to put it in the chat? Someone asked to put up the contact information again, so I will do that. Okay. Lots of thank you and appreciation to Lisa and Michelle and Mark for being here today. Another question that I did see coming through the chat was around professional development and online virtual professional development. So I just wanted to really quickly before we go share that if you want to follow our social media, we've been posting different virtual opportunities that we're offering for Michigan AEYC. We also have our calendar. The link is here on the screen, or you can follow. We're also putting things in my registry that are going to be offered virtually that are complimentary for people to be able to access professional development and training hours, since so many conferences and professional developments and trainings have been canceled with everything happening. So wanted to put those resources out there for additional opportunities for virtual professional development and earning those training hours and sketches for people that need to continue to earn those during this time. And then finally, just a final note of appreciation to all of you, to our panelists that were here today, and really appreciate everything that everyone's doing, and to just a final word of staying safe and healthy, and take care of yourselves and your families and those that you love and care about. Thank you all for being here.